Hello, everyone. Warm welcome to our very first Impact Accelerator Launchpad Hackathon. And I am here today with Jenny Sequeira. That is a part of the Geneva Learning Foundation. And I just want to make a Jenny co-host. So that is done. So welcome to you, Jenny.
Thank you, Charlotte. I'm very excited to be part of this.
So it's so great to have you with us here today. And I do hope you can see my screen. So if you cannot hear me, it means that you have surely not turned on audio on your device. So just click on join audio and then you call using internet. So if you cannot hear me, I would like to invite you, click on join audio and call using internet so that you can hear everything that is being said during this session. So it's a hackathon. It's just 30 minutes of your time, but I just want to quickly remind us of what we have for this week. So if you have not yet submitted your goal, you received a mail from Reda yesterday, please, today is the deadline, go ahead and do so. Also, you have to make sure that you complete your action for the week, the action that you set out that you were going to complete this week. You can work on that between Wednesday and Friday, because next week you're going to tell us how you did. And so I'm so glad. Just mark this date and time on your calendar. That's every Tuesday, 5 p.m. Geneva time. There will be more sessions like the one of today with Jenny and myself. So if you have not yet registered, go ahead and do so. So there is also, if you want to share your challenge, so that you can get help on implementation from peers and also share your experience and help others, you can use, I'm just going to share the link right here with you in the chat. So you can use this link to submit your story with us. So we already received a number of stories since the links was sent by mail yesterday. And today we are going to be listening to one of the story owners, one of the challenge owners that is already right here in the room with us. I just want to say a warm welcome to Clement. Clement Avoka. Unfortunately, it's as if I can't, he probably has connectivity issues. He may have left the room. So we do hope that he's able to sort the issues of connectivity that he may have so that he can join us to regain the room once again. If not, even if, okay, so I see he actually got disconnected and he's trying to join us back again. So while Clement is coming back into the room, I was just saying earlier on that if you want us to share, you want to share your story during one of these sessions, you just need to click on the link that I'm going to put once again into the chat, and you'll share your story with us. So today I'm going to invite Clement Avoka to unmute. Oh, he's still trying to connect to the audio, and he's going to tell us what his challenge is all about. So Clement, sorry, we hope that connectivity is going to be on your side and that you'll be able to unmute and share your story with us today. So over to you, Clement. Can you unmute yourself? And if you can see on the chat, you'll see the questions that were submitted in the challenge form that he already answered to. So he talked about the challenge is low demand for immunization services that leads to poor coverage and a pile up of unvaccinated children. So over to you, Clement.
Yeah, good evening.
Evening. So can you start by introducing yourself, telling us who you are and where you work? Clement. So Clement may be having connectivity issues. So while he's trying to get to us, I'll just say what he said in his story. He said he identified this challenge through coverage analysis, and he had a meeting with healthcare providers and care if you look at the slide on the screen, I hope you can see it. That's the story that he shared. So Clement, I don't know if you're able to speak now. Over to you. And if you're just joining us, a warm welcome to you. Unfortunately, we are unable to hear Clement, but I'm happy that Jenny, you are here. So I'm going to read what Clement shared with us. And if you have any questions, you can type them into the chat. And I'm sure Clement will be able to answer the questions, and we'll also turn to Jenny to hear her thoughts concerning this story shared by Clement. So we asked him what have you done to learn more about this challenge. So he said, I had a meeting with healthcare providers and caregivers. This was a performance review meeting where we invited key stakeholders, including but not limited to caregivers, health workers, opinion leaders, and chiefs to look at key performance issues. I made a presentation on the immunization performance in the district comparing 3 years trends. Everyone got alarmed about the low coverage. He continues to say, we discussed a lot about the downward trends of the immunization coverage. I also made a presentation on my proposed strategy, which was an action plan developed in the WHO Scholar Program. That is the use of the accompanies concept, where caregivers volunteer to help each other complete their children's immunization schedule by providing reminders and motivating one another to start and complete. This was seen as a great idea, and all stakeholders are ready to support it. This project was piloted in one of the sub-districts in the early parts of 2020, and the COVID-19 interfered with most of the activities. But still, performance in that sub-district has improved as compared to previous years and to other facilities in the district. We are now looking at getting funding to roll out the project to other sub-districts. And just to say that Clement Avoka, he works at the district level, and that his challenge, if he categorized it under the strategic priority 2 of the IA 2030 agenda, that is commitment and demand. So he went ahead to say that the solution he tried was the peer-to-peer support. As you saw, he mentioned previously about using the accompanies concept, which is the concept developed for the Geneva Learning Foundation courses, in which scholar alumni get to support scholars that are just joining the courses to make it through peer-to-peer support. So he said nurses, caregivers themselves, and funds to undertake a monthly meeting. That is what was going to help him. So his lessons learned so far is that inadequate funding for immunization services at the lower level is affecting performance. And he would like, what else you want to know about the challenge is that his action plans are ready, but there are no funds to implement them. So basically, I do hope right now that unfortunately, we have totally lost Clement, but the recording of the session will definitely be available, and he should be able to listen to it and learn from what he will hear from what is being shared today. And I see he's still trying to join the room again. I hope it is good this time around. So, and that is the issue of connectivity is a problem that we all face from time to time. It's so we understand the situation, and we are happy that in spite of making efforts to be able to join. So if I may, I'll just explain the case again for better understanding. So he said he developed this action plan based on the accompanies concept, which he learned from the WHO scholar courses. And the accompanies concept is all about scholars who have done a previous course, scholar alumni, coming and volunteering to support other scholars who have just joined a course to give them technical support, to mentor them, to get them through the course. So he was able to transpose this concept into his action plan in this case, it was caregivers, that is mothers, people that take care of the immunization target population, that's the children, that are able to support one another. That is to invite their peers who also have children to get them vaccinated, to follow up, to ensure that once the child has started, they get to complete their vaccination schedule. And he said this plan was, first of all, piloted in one of the sub-districts in his district, and it was very successful because it got them to improve upon coverage. And now his challenge is, how does he get to expand this strategy to the rest of his health district, to all the other sub-districts in his district in Ghana. So I see Clement is back with us. I hope, Clement, you can go ahead and unmute yourself if there is any more that you would like to add to the story that you shared. If not, I'm going to turn towards Jenny. And if you in your context, you have had a similar experience, I'd like to welcome you. What have you done? How do you get to extend a project that you have started from a pilot to extend it to the rest of your district or other health facilities in your district? So over to you, Clement.
Thank you very much, Charlotte. Good evening, everybody. I'm so sorry for the connectivity problems. But Charlotte, you have done a very wonderful runover of my presentation, and I think I can't say it much better than you have done. The challenge now is that how do we get funding to roll over this project to the other sub-districts? When we started in 2020, the Eastern Regional Health Directorate supported us with some funding, which we used to do the piloting in one sub-district. The result was good, even though we had some of the funding, the funds that was left that we intend to, add to more sub-districts. But unfortunately, around March, the COVID-19 pandemic, it just came and everything came to a standstill. As at now, I can't even trace where the rest of that funds are. It has been used to support immunization activities in the COVID era, and we are now looking at mobilizing new funding to see if we can cover other sub-districts with this project. Women that we've mobilized, we named them companies, volunteers who were moving from house to house to provide reminders to their own colleagues. We're so excited when they have monthly meetings with CHOs or nurses to prepare them for their home visits. And I think this was so excellent in increasing the patronage and attendance at immunization sections, because we realized that we are living in a very complex society today where everybody gets busy on a daily basis and will forget certain things. If an uneducated woman has to remember an immunization section that was told to her a month ago, they find it difficult to remember, and some of them just forget to come for the immunization. But if they have their own colleagues that are visiting them to give them reminders a day before the section, and even follow up on them with calls, motivate them and encourage them to come, then this definitely increases the attendance for a particular section. And this is what I seek to do from the WHO Scholars Program, of course, taking their company's concept from the learning foundation to the real immunization environment. Thank you very much.
Okay, so thank you so much, Clement Abubakar. We are so glad that you are able to join us once again. And I would like to turn now towards Jenny. Jenny, you've listened to Clement explain what he did, his concept, and the dilemma, the challenge he's facing now. Do you have any other questions you may want to ask him to get a clearer, a better understanding of what he did?
Thank you, Charlotte, and thanks very much, Clement. This is a really great example of going to a particular issue and having specific solution for a bigger problem. So I appreciate the way that you've gotten very granular and detailed, because I think yesterday we were talking about smart plans and things that talked about processes. So this very much aligns with that. So I applaud you. You know, I think a big challenge with immunization and public health in general is that we test projects or pilots, and then, you know, the scale up for it to become part of the program is always challenged because of funds or other resource constraints. And so I know that you mentioned that there were costs associated with the meetings, but I wanted to challenge you and to say, within the budget of the health facility, is there any way that you can see to scale this up within the resources of that health facility? Because I think the harsh reality that many of us are facing is that, you know, COVID has impacted the lives of many people, but also the economy in a huge, huge way. And that economic impact is going to have pretty much, I think, a long effect on public health budgets and health funding at the lower level. And so I would encourage you to think about what's possible within the resource availability to scale this up. It might not be exactly the same concept, but this idea of accompanist, I think, is a really great idea. And wanted to throw the question back to you about how do you think it could be scaled up in a way that isn't sort of project mindset, but it's embedded in the program of what immunization is doing in health facilities. I would also request all of the participants in the chat room, if you have tested anything like similar to the accompanist concept, to just write a few things in the chat box. Back to you, Clement. Charlotte, I hope, is Clement still on the line?
Unfortunately, it's as if we have lost Clement again, Jenny. So I just want to, so I'm sure others in the room, they heard your question, and I would like to encourage, if you have listened to Clement's story today, and it speaks to you, like Jenny asked, have you used the accompanist concept before, or anything that is closer to this? Because there are different names that are given to women that mobilize to support one another for immunization in different contexts. So if you have had any experience, please, can you get to share it now? You are not going to prescribe to Clement what he's going to be doing, how he's going to go about doing his content, but from your experience, what have you done and what results do you get? So you may want to raise your hand or type in the chat if you cannot speak. Yes, Rena.
Yes, Charlotte, thank you. I think we skipped a step where we didn't quite explain what is a hackathon and how is the process going to work. So just for participants who have joined us, we've heard one compelling example with some detail despite connection problems, but there will always be connection problems. So we have to help Clement. That is our mission in the hackathon today, is to help him with his plan and with the available information, that with what we know. So there'll be lots of gaps, but that's like in the real world. You're not going to know everything you want or need to know. And then really this is about asking you, Deepak Kumar Patro from India, asking you, Abubakar Mohammed Garba, asking you, Abigail, Ahmad, Amel, Amina, Boma, and so on. Does this, if you, as you listen to Clement's case, if this makes sense to you, if this is of interest to you, if you think, oh, something like this happened to me, then really this is what we mean by share your experience back with him. How can you help him? It's kind of like when we do peer review. And one of the rules we have that I think we'll need to remind participants in the next sessions is, you don't say you should do this or you should do that. You say, this happened to me, this is what I did, and this is how it turned out to me. And be specific in your contribution. This is not just about sharing your general opinion. It's about, think about, if I'm going to say something, how is that going to help Clement and other colleagues? So those are really the principles of the hackathon. And I hope they make sense to the participants. If you were in Teach to Reach, you may have already participated in these. Back to you, Charlotte.
Okay, thank you, Reda. So You can type in your thoughts in the chat if you're unable to speak. And I see Clement is back with us, but I don't know if Clement actually got your all of your question, Jenny, but I'm inviting him to unmute. He's going to tell us how far he got with hearing your question, and then if he needs more clarification. So Clement, if you're able to unmute yourself. If not, I'm going to be inviting other scholars in the room. What are your thoughts? Have you? Okay, I see Marie Goriti or Otieno. Marie Goriti, please go ahead and unmute yourself. And please tell us who you are, where you work.
Thank you so much. I'm Marie Goriti. I come from Nairobi, Kenya. I'm a researcher. And what I would share with the Clement is that I've learned from last year when COVID was at its peak. There were very few people who could move around to vaccinate, offer vaccine services. And because I was on the ground collecting data on tackling girls' barriers to schools in that particular area, I urge them to make use of volunteers from the area. And this is because colleges were closed, schools were closed, and these are people who could be used to move around and help in immunization services. And this helped a lot because it bridged the gap and they reduced the distance between clinics and also took care of the works other routine workers would have done and were not able to do because of COVID. So the project is very good. The use of volunteers works very well in crisis and can be something which is also domiciled in the region where you work in, and they can do a very good job. So well done to the scholar. Thank you.
Thank you very much, Mary Goretti. So you talk about the use of volunteers. I'm going to turn to Deepak Kumar Patro. Your mic is unmuted. I don't know if you have something to share back with Clement based on your experience.
Yeah, myself, Deepak Kumar Patro from India. And in the time of COVID-19, here situation was very worse, and it is very difficult to face the situation. Nobody can do it in the time of vaccination. The vaccination hesitancy is there, and people were fearing to take vaccine. So in that time, I was going there and motivated them to take vaccine, and vaccine will be more helpful for them, and they will be more secured without a vaccine, as they feel after taking vaccine they will be more secure. So gradually the people has been aware, and they are starting to take vaccines. And now the situation is previously better, but now it is better than the previous stage. Hello?
Okay, thank you very much, Deepak Kumar Patro.
Yeah.
For that, I would like to find out from you. I'd like to find out from you, how did you get to convince the people? How did you use volunteers or caregivers to be able to ask their peers or encourage their peers to accept the vaccines?
It should be taken from the government, ma'am. It should, the proper steps should be taken from the government, and it should be delivered from door to door, because all people are not being able to move forward, and all people are not rich, ma'am, and most of the people are poor. they are not being able to move forward. So the government should be taken the steps to deliver the medicine in the free of cost from door-to-door delivery by asking them the members who have been vaccinated and who have not been vaccinated. So by taking the proper data on the primary data only, the vaccination should be done. The secondary data is not it is not accurate. So that's why the accelerator should be done by the government only, not by the private persons, because private persons are not honest and they are not being able to do their work and duty properly, honestly. So, as per my opinion, the honest persons should be appointed or by the government or by any concerned authority or department by which the people will be benefited.
Okay, thank you very much, Deepak Kumar. I see
Hello.
Boma Otobo. Boma Otobo, your hand is raised. Can you, Boma, please go ahead and unmute yourself.
Okay, thank you so much, Charlotte, and thanks, Jenny, also. Yes, I just want to put my voice to this conversation. I can see the challenges, funds, having funds so that the project can be scaled up to other districts that are not also performing well. One thing we need to encourage health workers to do is to look at this concept of integration in the sense that an activity could be going on and may be funded. So what can this other activity benefit from what is happening, in the sense that I will use the polio example, where my country has been able to eradicate polio, but we see a lot of outbreak of CVD, PV2, and so there's some funding going into the OBR campaigns, the outbreak response campaigns. So if, for instance, there's a fixed facility that is not doing very well, the teams that will go from there to the communities to give the polio, the oral polio, or whatever type of polio they're using, the vaccine, what they can do is when they get to the community, they should request to see the vaccination card of the children that are in that community. So because they are going to check for under 5s, so we would also now use the opportunity to track the under ones that have missed their vaccinations or have not even come for them at all. They are 0 doses. So they can now be referred to the facility so that they too can be vaccinated and become up to date. By doing that, they would find that the vaccination coverage would definitely go up because the healthcare workers are able to reach the places they couldn't reach because of lack of funds. So that's just one thing I'd like to contribute to. Thank you. Over.
Thank you very much, Boma Otobo, for that contribution. And I see Jenny says in the chat, great idea to see if campaign funding can be leveraged to support routine work. Jenny, any more thoughts?
Yeah, thank you, Charlotte, and thank you, Boma. You know, the financial constraints and resource constraints are going to be ongoing challenges. That's just the reality. And so I think being very open about the day-to-day work, the routine work that health workers do in and out, day in and out, is the most important. That's the fundamental foundation of primary healthcare, that you have reliable services, the health workers have regular contact with communities. The campaigns come and go intermittently, but if they can be used, you know, with COVID, there will be probably more and more mini campaigns or PERI-like events, you know, the periodic intensification of routine immunization. So the more those periodic events can be capitalized to support particular things in routine immunization or primary healthcare, I think that's part of the creative problem solving. And I love Boma's idea because it's taking things that you know will have funding Campaigns tend to have much more external support, and the routine work is through the government resources. So it's important to be able to pull from all directions and to see what you can do. I would also like to challenge everyone again to say what is possible as you move from a time-bound project with testing something and you're scaling something up that you want to be within the program, which means permanently. How can you do that in a way that does it within your existing resources? I want to challenge people in that respect, because I know that the things like this, the meetings take time, they take money for refreshments and other things, but are there ways to change them or adapt them in a way that's affordable permanently for the health facilities to take them up? So I don't know if Clement is back, if he can delve a little bit more into if there's ways to adapt the accompanist concept, or if others have ideas of how you can use resources, existing resources, to scale something up permanently. The accompanist intervention is not something that you just want to scale up and test for a little bit, but it's shown promise, it's shown that it's successful. So what are you doing to make sure it's now part of the permanent year in, year out way of working? So back to Clement if he's around. If not, then Charlotte, maybe we can ask for additional ideas about how to work within existing resources.
Exactly, Jenny, thank you very much. So we are already 1 minute over the allotted time for the hackathon. We respect how busy you are with your daily work. However, Jenny and I would like to offer to stay for additional time if you want to share your experience, to help Clement Abubakar with his challenge. And even if Clement is not here, the recording of the session will be available, so he would want to view it later on. So please go ahead and raise your hand if you want to share your experience with us today. So, okay, I see Abubakar Mohammed says in the chat, linking up campaign with school, that is with school attached teachers will also lead to vaccination tracking and uptake. So I see Raimi Morufu. Okay, over to you, Raimi. Your mic is already unmuted.
Yes, good evening, good morning, and good night, depending on whichever country you are. I will be speaking in relation to what we do here in Bayelsa State. Recently, the government engaged some graduates under the Empower Health, and they were all posted to health facilities. So what we do in the state is to engage those graduates who are already who have health-related discipline, those who are medical doctor, nurse, environmental health officers, health information officers, and what have you, to engage them in those various facilities in Bayelsa State. And in each of those facilities, we have started doing our micro plan, and which we are now inculcating those Empower staff that was sent by federal government to the 36 states in Nigeria. And from the state level, we are also funding those activities that has been spelled out in each of their micro plan, probably be it fixed post or outreach. And so far, so good. There have been tremendous progress, because a lot of them are willing to work, they are willing to learn, and this issue of having health workers who are employed by the state government, but unfortunately do not go to their place of work, but keep collecting salary, and which has actually brought our immunization coverage and data reporting to various minimum, because recently the Primary Healthcare Board, they came to make some presentation to show us the level in which we are at the state. It is upon that we have to change our tactics in the way and manner we engage the end power, which at the moment is yielding positive results. So this is the situation in Bayelsa State in Nigeria. Over to you. Thank you.
Thank you.
Okay, thank you very much, Raimi Morufu Olalekan. And please, if you, before you mute yourself, can you just introduce yourself briefly, state who you are, and where you work, so that the challenge owner will actually understand more about the context.
Okay, I'm the lead M&E officer under the Save 1 Million Life program. So I work more as a consultant to the Ministry of Health, Bayelsa State Ministry of Health, under the Office of the Commissioner of Health.
Okay, thank you very much, Jenny. And
yeah.
okay,
Charlotte,
yes.
I know we're running out of time. We have probably 10 more minutes left. And I know when we share our examples, all of us have huge challenges. But if we can focus on how do we advise Clement, the idea is we pick a challenge, 1 or 2 challenges every session, and then crowdsource ideas for that challenge. Does anybody have any last advice, that we want to give Clement or others who may have challenges with how to scale something up, a very good idea, how to scale it up with limited resources? So Charlotte, I don't know if we can pick on 1 or maybe 2 more people, but request that they focus on how to advise Clement based on their experiences with similar challenges.
Yeah, exactly. So if you have, you want to share your own experience, please just go ahead. You have the possibility of unmuting yourself directly, or you just raise your hand if you want to follow some protocol, but you can go ahead and unmute. And it's about helping Clement with his challenge on how he can scale up. That is his action plan to move from one sub-district to all of the other sub-districts. And as Jenny said, not just do it in terms of a project, but actually how to make it sustainable, that will have these accompanied caregivers that are there to support one another, ensure that their children get all the needed vaccines and respect the vaccination schedule. So if not, you could also share your thoughts in the chat. Okay, I see Abubakar Mohammed Garba. Your mic is unmuted. Over to you. And please start by introducing yourself, telling us who you work, your system level, and how you can help Clement.
Good morning, good afternoon, and good evening. I am Mohammed Abubakar Garba, calling from Nigeria here in Gombe State. I work with Ramadan Nursing Home, which is a private facility, and I also serve my state as COVID-19 response team. My thought here and say here is, as I said in my comment, linking with students as like my colleagues say, link with students and teachers, it will bring a result of tracking immunization, and it will bring immunization uptake. Let's say, for example, this vaccines is something that will make a child feel confidence to take it. So let's say that we have linked the vaccines with students and give them assignments, definition of hepatitis B, definition of these vaccines. So the student will take the assignment back to home, and then some of the parents used to teach their child how to do assignment. So they will see that since from school, immunization has been teaching and it has been put in a syllabus. So it will also encourage our mothers to bring out their children to vaccination. That's small that I'm going to say. Thanks and over.
Okay, thank you very much, Abubakar. So what I get is involving teachers and school children in order. That is one way of empowering the mothers who are accompanists, so that they can have the right information that they will share with their peers on immunization.
Yeah,
okay, thank
That's
you.
What I mean.
Okay, thank you very much. So any other experience to be shared, please go ahead, unmute, raise your hand. If not, we are 5 minutes from the end of this. And before I want to, kind of like remind you of what is going to happen next as far as the IA 2030 Impact Accelerator Launchpad goes. I would like to turn once again towards Jenny, just to briefly recap, what is the take-home message if Clement was to leave here today, having had a start to the solution to his challenge. So what will be your take-home message for him?
Great, thank you, Charlotte. Well, in spite of the challenges that COVID presented, the accompanist concept was shown to be successful when it was tested in one sub-district. So the idea is people believe, they've seen the data, they've seen the successes, and they want to scale it up. And so I think the biggest part of this is thinking about when you scale something up, you're basically saying we're moving from a time-bound project to a permanent part of the program. What can we do to use existing resources to do that? If it requires additional resources, then that's something that you would have to really think about. Is it feasible? You want to scale something up with only 1 year of funding and then have the challenge of it maybe not continuing year to year because of lack of additional funding. So I think that the challenge is something that's commonly seen where there's a good idea, but there are some funding requirements or resource requirements to scale it up in exactly the same way. So you might need to make some concessions and some compromises if you want to scale it up in a way that might require less resources and within the budget that you have. But I would also like to encourage others, as we go through these hackathons, to think about your experience and how you can contribute to the challenge owner, and also looking at what you've heard about or read about elsewhere. An example I just want to leave you with for you to read about if you have time is there's an approach called Group ANC, which uses the same concept of accompanist that they've tested in ANC with a group of women who come, they're due around the same time to give birth. And so the facility asks them to all come at the same time for their ANC, and they have a group that's, they give themselves a nickname, and then when they go out, they are that group. So, there's ideas you can use around accompanists to say, if mothers have a child who is around the same age, is it possible to think about group immunization? That's an adaptation of the accompanist method that might be successful and with less resources if it's taken to scale. I don't know. We have to be creative, especially during resource constrained times. So back to you, Charlotte, and looking forward to the hackathon sessions coming up every week.
Okay, thank you very much, Jenny, and thanks to Mojirola Fasiku for the comment you left in the chat. So I think it's important to highlight the next step. If you have not yet done so, please submit your goal and action plan for this week. There is a mail you received yesterday from Reda, and the first item was for you to join today's hackathon, but also the second item was for you to define the objective you will achieve by the 3rd of December and the action you will complete. It's a simple form that you need to fill, and once you have filled that form, you will receive a notification saying that your goal and action has been received, and you can review it to ensure that your goal is achievable and it's specific as far as what you want to attain in the next 4 weeks is concerned. Also, you have to complete your action for the week between Wednesday and Friday, because next Monday, during the General Assembly, we are going to ask you, how did you do? And remember, at the end of the 4 weeks, you also need to tell us, you need to tell your peers how you did with the objective, with the goal that you set at the beginning of the 4 weeks. So also, we are looking forward to seeing you next Monday for the General Assembly. Then you can, if you, yes, Reda, please.
No, please finish. I just want to make one last comment.
Okay, so I just wanted to, if you have listened to Clement Avoca's story today, challenge, and you also have a similar or different challenge altogether that you are facing, and you want to help from your peers, please go ahead. You can submit your challenge by filling the following form, and I'm going to share the link again in the chat. If you have not yet submitted your story, go ahead. Your story could be the next that is being looked at, and you could get to hear receive help from the experiences of others. So also there is a resource folder for the Impact Accelerator, where you can have access to all of the recordings and the slides of the different sessions and all other relevant material for the accelerator. And I see Jenny has shared in the chat concerning the group and C that she mentioned in her closing remark. You can click on the link. It could also be helpful if you want to move forward with the idea on using the accompanies concept to increase demand for immunization services. So I'm going to turn towards Reda for his own closing statement.
Thank you, Charlotte. That's a lot of housekeeping information, and it's very important. But I'd like to close with coming back to the core purpose, the heart and soul of what we're doing with the Impact Accelerator, and that is really for you to focus. At the end of the day, what we want to know is, have you made progress with your action plan? Have you been able to carry out the steps that are actually helping you make it happen, get it done? So what Charlotte has presented are tools. It may take a little bit of time for you to make sense. What is each one? What are all these links? But at the end of the day, this is all about supporting each other to make progress faster and better. So take a few minutes to make sense of the resources that we share, the links and so on, but then go back to focusing on what are you doing next with your action plan. And you realize that the two are connected, that if you use the tools, it'll be easier to figure out what you're doing next. And then carrying out the steps is still going to be entirely dependent upon you, your motivation, your willingness to take this forward. Thank you, Charlotte. And thank you for this first session.
Okay, thank you, everyone. Thank you, Reda. Thank you, Jenny. Thank you, Francois, that was there with us in the background. I'm looking forward to seeing you next Monday for the General Assembly, and obviously next Tuesday at the same time, 5 p.m. Geneva time is the same link for our next session. Bye for now.